Here are 5 referral questions that every therapist is going to encounter when marketing to MDs. First is going to be what to do when an MD office tells you, hey, we already referred to someone. 2, do I bring in flyers on my first visit? 3, what do I do when a doctor's office goes cold? We're going to answer a couple of those and a few more after. But joining me today is Savannah Peterson, PTDU's head of MD marketing. She has built personally over a 200 patient census on her mobile Medicare Part B. She's the expert in this field and going to answer all questions that we have today. And let's get right into it. Savannah, welcome. Thanks for taking the time.
Thank you. Absolutely.
All right. Question 1. What to do when an office tells you, hey, we already refer to some therapy group?
I love that because this question has happened to me on several occasions. Your first response to that is always going to be one of a positive nature because we always want to present with the utmost respect for their current processes and procedures with however they decide to typically handle referrals. But I think the beauty is that there's always space for more than one option. And so typically when I'm talking to the offices or I'm presented with this type of question, my response would be something to the effect of, that's so great to hear that you already have someone that you use on a regular basis. I think I may come in a little bit handy in a different way. One, in a way which being I'm right around the corner from your patient's house. 2, are you sure you have somebody that actually does Medicare Part B mobile therapy? So that's probably a little bit of an area that you may want to dive in further into your individual specialty because it's going to be pretty rare that they have someone that does exactly to the T what you do. Maybe they're grouping you with home care. Maybe they're grouping you in with some of the other types of practices that utilize therapy services. So I would try to dig a little bit more. But ultimately, you're here to be another resource in their back pocket. That's great. Well, if you need someone else, I want to be on the back burner for you. And hopefully, sometimes patients just need another set of eyes. So maybe I'm the person that gets to see that patient on the back end that didn't have a good experience with the practice that you used the first time. So there's a number of ways that you could go about it. But I always start with something positive, recognizing that they have a good relationship already. And then 2, going ahead and building off of what you've already educated them on as far as your services and what you have available as far as providing to them.
A lot of these MD offices, like I said, they may have an in-house clinic. They may have a therapy group that's literally right attached to them. But what you guys are offering is different. It's mobile. So don't be afraid to really go in there and say, hey, if you guys ever have patients that can't come to the office here, I'd love to be that kind of resource. And that may catch little people off guard because some of these providers don't even know that you can do outpatient therapy in the home. And I'm sure they have a group of people or they're people coming to the doctor's office say, hey, I don't really want to come to the clinic. So there's a big subsect of that population. Then you can still go in there confident knowing, say, hey, I'm not trying to compete with you. If I'm talking about if they already have a therapy group, maybe in-house or associated right with the doctor. But hey, I'd love to come see your patients at home here. We had a therapist who literally was working with a Medicare patient at home, but exactly say, hey, we have a brick and mortar, but hey, this is an awesome service that you provide, and I want to tell my other patients about it. And that's a huge bonus and positive that the traditional route it can't compete with or can work symbiotically with together.
Absolutely.
All right, question 2. Is the goal of the office visit to speak with the referral coordinator or the actual provider?
This is a tough one because ideally, I would say both. You want a relationship with every single person that is in that office. So whether it's the front desk person, whether it's referral coordinator or the provider, ideally you want a relationship with all 3. Now, if you had to decide who is the most important person in that relationship, it's going to vary from office to office because it depends on what their typical paradigm is. And most of the time, you're going to have to build a baseline level of a relationship and a mutual respect with the referral coordinator in order to get to the provider. So I would say take it step by step, build each office uniquely and see what their existing structure is as far as how they refer patients. If the person at the desk tells you, oh, the provider or the doctor is the one that typically is the one that decides where to send the patients, or, oh, we have a referral coordinator, she handles everything. Whoever that person is, that's going to be your first line. And then ultimately after that, you're going to want to build relationships surrounding that. So take at least a couple visits to get to know that referral coordinator, and then you continue to build off of that. You know what I realized? I've never had the opportunity to meet Dr. Smith. Is he actually around? I'd love a couple minutes just to introduce myself really quick. And already you have that trust from the referral coordinator. They've they know you, they want to build a relationship with you. And then I think at that point, it's not necessarily like an ask, you're trying to circumvent that person. It's just that you've built the relationship with that person, you're looking to enhance it. Oftentimes the referral coordinator ends up being the gatekeeper of the physician. So that's why you have to work both angles of it equally.
Yeah, like I said, it varies office to office. This is where the layering of those visits take place. Not everything happens on the first visit, like we've talked about in past conversations. So depending on, like you said, exactly doing those proper discovery questions about, hey, who does give out the referrals here? Or is it just the provider? Or do these offices even have a referral coordinator? Is it an MA, et cetera? So doing that due diligence when you're talking with maybe the office admin the first time you're going in there and trying to do some discovery work will help you put in the right direction.
Yes. One other thing while you're just talking, I was thinking too, is that, ultimately, like the best relationship would be with the doctor because they're the one that they're running the show, right? And they also have that insight of like clinical value and personality, and they understand that really matters with who they're sending out to that patient, especially when it's in the home. So it really does provide a lot of value for you to be able to get in with the physician, but at the end of the day, you got to build it with everybody. But the doctor knows that matters when it comes to who they're sending out to the house versus, who takes every insurance, who's the easiest to use.
Question 3, do I bring business cards and flyers to the doctor's office, and or do I do it on the first time I go in?
Love this question. Do not drop and dash. Hey, here are some business cards. Have a nice day. So always preface it with some type of background information. On my first visit, I'm always going to drop something because if they don't have anything, then how are they going to remember how to refer to you? So I'm at least going to leave a business card or a business card and a rack card. But on my first visit, I'm never giving away the whole thing because then you're kind of running out of things to provide to them as you go. And if you just give a bunch of rack cards up front, if anything, it kind of seems like you value what you do a lot more. If you just say, oh, well, here's a business card, reach out to me. And if you have patients that prefer to use business cards or rack cards, I'll bring more on my next visit. And so that gives you another reason to kind of have a good follow-up visit on the back end, but not necessarily just dump everything on the first visit. So that's going to be really important. Leave a little bit, but leave room for you to have things to talk about afterwards. What I love too is that on those subsequent visits, we were talking about this on a call last week, so I want to weave this in here, is have stories to talk about as far as your patients go. Even if it's not their patient, giving them the business card on the first visit. All right, I'm going to come back in 2 weeks here just to say hello and remind you guys about my service. Remind you guys about my practice. It was so great to meet you. Coming back in 2 weeks. Oh my gosh, I just saw someone down the street from your office. It reminded me to come back in here. They had low back pain. And it was great because within the first 30 minutes of the session, the patient was reporting already, reduced symptoms, reduced inflammation, whatever the case is, you have something to kind of weave into that discussion. So yes, leave a few, but leave room for you to leave more in future visits.
Yes. And a mistake, I've made in the past, and I want you to speak to this too, is going in there and saying, hey, can you hand these out to patients for me? Yeah. Elaborate. But that's like kind of natural thing to do because you bring them in, you're like, hey, can you give these out to people for me? It becomes inconsequently transactional almost. And that's just where a novice or someone can go in and say, hey, well, I brought these. Please give these out to your patients. So kind of go off that and how to maybe avoid that or get them to ask you for your cards and rack cards to then give out.
Correct. Yes. If they're asking you for it, even better. If anything, I'm holding out on that business card until like the last possible second. And if they ask you for it, it feels even better because it's obviously expressing that there's interest there. So yeah, that's a really good point.
Question 4, what is one small thing you've done in marketing that's made a big difference in driving patients?
Yeah, really, it's the layering of the updates, I think, with the office that really matter because typically when they're sending out an order, they're just expecting that you call, you schedule, they receive the information via fax. We like easy, right? But adding a level of personalization and just saying, oh, I just saw Mrs. Smith and Mrs. Smith had, X, Y, and Z. I actually tried this. What do you think about this? She responded really well to it. Or I think just overall, like expressing your connection with the patient is what's going to set you aside from other providers that are simply treating and rendering providers versus relational. Like the relational aspect of what we do, especially with PTTU, is by far the most important thing. So the more that you can build the relationship and show that you really care. I mean, of course, we're all in healthcare, right? So everybody cares about staying healthy, but they know whether you're being authentic or not. So the more that you show that you're in it for the long term and you're vested in that patient's long-term health, the better off it's going to go. So if I could say anything, it truly is, it is the little things. It's not just showing up with your business cards. It's knowing what's going on with that patient, what exercise you did, or what things provided value versus didn't, and having something to talk about in that way.
Question 5, what to do when an office goes cold? Let's say a doctor's office has sent referrals to a therapist, maybe got a few referrals in a month, then 2 months goes by and they haven't heard anything from that doctor's office, or they haven't received a new referral. What do I do next?
First, I think I've said this on other calls, so I'm going to weave this in. I always try to be introspective. Have I been following up as much as I should have? Did I say thank you? Did I write my thank you cards to this doctor? Have I been following up with the office as consistently as I was to begin with? Do they require that level of follow-up? Did anything go wrong with that patient, or do they genuinely just not have the volume? Because oftentimes you can kind of you think of like the worst case scenario, which is like, oh, well, something must have gone wrong, but maybe they forgot. Or maybe they funnel referrals to different people, and then your job is really to go back in and just say, hey, I saw Mr. So-and-so about a month ago. I'm ready for my next patient. When you have somebody for me, give me a call. And just kind of, you ask for the patient, but in a way that is just, again, expressing that you're going to get that patient, right? Like you're not begging for the patient. The patients are coming to you, but weave it in a way that is just, again, expecting that you're going to continue to work with them. And if you feel like the office has generally gotten cold and you can't determine why, ask, because you know what? If you don't have the answer, then you never know why. I'll give an example. I had an office that used to refer a ton of patients, and all of a sudden, like going from 10 patients a month to just 0 and first I gave it a month, I gave it 2 months, kept going in, kept doing my thing as I normally would. Still nothing. I asked the doctor, oh, I became a medical director somewhere else. So it was literally nothing personal. It's just that they had to give their referrals to somewhere else because of an incentive-based program. So never be afraid to ask. I think if it's over 30 days, that's going to be your mark or your point, that if you've been working with them consistently and they stop sending for over a month, then something happened. Maybe there's a new staff member along the way that you didn't know about. So dig a little bit in the office. If you don't see anything that comes up immediately, then ask. And you can say it in a way that is not transactional. You can say it in a way that's like, I loved working with your patients. I haven't seen anything recently. You guys slow, or what's going on around here? And just ask in a way that is inquisitive, but not condescending.
From my experience, usually it always comes with a lack of follow-up, where maybe you got a little too comfortable and maybe 30 days went by and you saw one of their patients, 2 of their patients, and then you forgot to pop in. Maybe you forgot to drop off a card, you forgot to say, hey, thank you. And that's not saying the relationship's gone. It's very easy to pick back up at a place that's already sent you patients because you have that initial relationship. That's where staying consistent on it, just like how you have to market to, like I said, get that doctor's office referring to you. You don't have to go at that same cadence to maintain that relationship, but it is important that you do maintain that relationship. And a lot of people think they do all the legwork up front, and then once they get a patient, they're done. And that's not the case. You maybe scale back a little bit, but you still have to layer in the follow-ups. And that's where tracking on your Excel sheet, on your doors list, marking down when the last time you spoke with the offices, and planning the next time you will. If you're tracking your cadence and your follow-up and your appointments, you will never run into this problem, because you'll know, hey, I haven't hit Dr. So-and-so's office in 30 days. And that's too long. And I need to send them a message or pop back in, stop by and bring them bagels, whatever it is, so you can keep maintaining that.
Yes. And if you feel like you're stuck, do something that is outside the box. Go and bring in a TheraBand and ask, have you ever tried to use a TheraBand before? Do you know 5 exercises for upper body? Oh, bring in a AirX pad, or bring in something. They're like, why are you walking in with this? Our therapist, Becca, walks in with a pelvic floor model. I mean, you name it. Like you could walk in with literally any tool in your toolbox that you would typically bring into a patient. Maybe it's a tool that you used on a patient that, oh, I use this with so and so. This is great. I wanted to show you guys what this is, and take the position of being the educator again, and put the ball back in your own court, and just do something off the wall that they're not expecting. They're expecting for you to come in with paper, right? So bring something that's a little bit outside the box, and you might get a different response from it. So I love doing stuff like that. Throw them off.
I love it. I
A
love
little
it.
curveball.
Perfect.
Yeah.
Those are 5 questions. Thank you for answering, Savannah. If you're a therapist thinking about building the caseload or looking to kind of get support, come work with PTDU. You can apply below in the link. We help therapists across the state of Florida build and grow their mobile Part B caseloads.